Hi, Jacqui.
Hi,
Lovely to see you.
lovely
And
to see you too.
we're so excited to introduce you to LoveRose Talks. And this is Jacqui Bassaragh, and she's one of our beautiful LoveRose models. You will have seen
Thank
her
you.
all over our Instagram. And so, Jacqui, it would be amazing if you could just tell the viewers a little bit about your cancer journey so far.
Okay, so I was diagnosed with stage 2 breast cancer in June 2018. The cancer was all contained in the milk duct. So I was very fortunate that it hadn't spread to the lymph nodes. So I had a skin sparing mastectomy and lymph node removal. I was so fortunate, again, I didn't need to have radiotherapy or chemotherapy.
Wow.
However, you would have thought that on paper that my recovery would have been speedy. I'd have been back on my feet in a relatively short space of time, but it wasn't like that. I was placed on letrozole, like hormone therapy, shortly after my mastectomy, and I had extreme side effects to that. One of the extreme side effects was I ended up with bilateral frozen shoulders.
Wow.
And numerous other side effects. I was on that drug for about 6 months, and I was taken off of that. I had a break, and then I was placed on tamoxifen. And again, I had extreme side effects to tamoxifen. Affected my cognitive ability. Didn't know whether I was coming or going. It was the fatigue. I would just be sitting, staring into space. Didn't know I was sleeping, the fatigue. I was sleeping for hours on end. There was numerous other side effects, but one of the main ones was my cognitive ability. I was having difficulty having a conversation and making myself understood. I'd keep saying things like, I can't remember, I'm finding difficulty to find the word that I want to spell. And I still have a bit of difficulty now, but I'm much improved. From there, when I was taken off tamoxifen, and I started having really chronic pelvic pains, and then was red alert, and I was tested for ovarian cancer and endometrial cancer, which was really scary. The anxiety levels start to raise really high again. But unfortunately, those the tests that I had were all negative, and it was nothing sinister. Fast forward, I was diagnosed with fibromyalgia.
Oh, okay.
Yes, and then fast forward again, I started to have some gastrointestinal issues. I'm on a medication called alendronic acid because I have osteopenia, which is a precursor to osteoporosis, and I've developed a condition called diverticulosis, and but that's an interim diagnosis. I'm still waiting for a colonoscopy to confirm that. So that's where I'm at. Because I've had a catalogue of side effects from the drugs, it's impeded on my employment. And I did actually return to work approximately 3 months after I had my mastectomy. I thought, as I usually do things, it's like, okay, I feel fine now, I'm ready to get back to normal. I lasted about a week on a phased return, and I think that was one of the lowest periods for me, because for me, an indicator that I'm getting back to normal is returning to work. And when I couldn't do that, I just felt completely lost and thinking, what do I do now?
Did you
Did
you get support with that? Did you have counseling, or was the medical teams down at your hospital, were they did you get help for that?
I had a lot of therapeutic services at the cancer centre, like acupuncture, massages and things like that. I did have a counselling session there, but it didn't go too well. Maybe I just didn't connect well with the counsellor.
Sometimes that
just happens. I think it was a bit of both. And And then I fortunately was referred to Black Women's Rising, and I went to the very first support group session, and that's been really an integral part of my progress psychologically. I really believe, you know.
Why do you feel that? What do you get from Black Women Rising?
There's a natural affiliation with the women. A lot of us come from the same backgrounds. A lot of us, I mean, there's a wide age group, but there's a large age group that are from the Windrush generation, and that our parents came here as part of the Windrush. And we've had very, very similar upbringings, very similar experiences. And outside of cancer, we have like common interests, you know, so it's not all just talking about cancer, because I think there's about 3 women in the group that actually went to my secondary school.
Really?
Yes.
Oh, wow.
Yeah, so it was like, oh my goodness, you went to my secondary school. So it's kind of been like a reconnecting with people that you grew up with as well.
Yeah.
So yeah,
it helps, doesn't it?
It does. And I think with any relationship, to be able to get the best out of it, you need to be able to understand and communicate well with each other and understand each other and feel comfortable as well.
Yeah.
And because without that, if you're not comfortable, and also trust, if you have that comfortability and that trust, you're going to get the most out of the support that's there for you.
Yeah. And did you take part in the exhibition that they held?
I did. Yes, the very first exhibition in March last year at the Peckham. I can't remember the name of the
Peckham Levels.
Yes, Peckham Levels. That's right. And then there was the exhibition at the Oxo Tower. I was there as well.
Yeah.
Amazing.
And so for that, did you take a photograph of your mastectomy scars?
Yes, I did. Yeah.
And how did that make you feel? Did it empower you? Did would you have done something like that, before cancer?
No way. No way I would. But I think if I'm honest, I don't see where I've had the mastectomy and reconstruction, that's no longer a breast to me, it's an artificial breast. So like in my photo, I've got my breast that's left covered up in a nipple, because to me that's still a breast, and there's no way that I would expose my natural breast, but that one is no longer a breast to me, so it doesn't feel like I'm exposing myself.
Yeah. That's so interesting. That's such an interesting kind of.
Yeah. Why did you opt for reconstruction, would you say?
I feel that I don't think that I psychologically would have coped without a reconstruction.
Mm-hmm.
And the part of me that's a woman, I don't think I know I wouldn't have coped with that. I think it would have been too much for me to manage.
And Jacqui, did you get an implant, or did you use a part of your body?
I had an implant, and the main reason I opted for immediate reconstruction with the implant, because I did have the option of having my stomach used, the fat from my stomach, but the reason I didn't, because the recovery time was longer, and and I just wanted to go back to work. I just wanted to put it behind me and get back to work, and it hasn't been like that. So I could have had a really nice fat stomach, but
hindsight.
But also, they have their pros and cons. All of
them. Both of them do. That's right. It doesn't work for everybody.
No, absolutely not. And it has to be your own kind of like preference at the end of the day. But how are you? How would you say you are now? So how long ago is it since your operation?
Well, I had my surgery in July 2018.
Okay.
And there were some issues with my implant, and I had to have corrective surgery in September last year. In terms of where I'm at
in your head?
In my head?
Yeah.
I think what's really affecting me is the long-term side effects from the medication. That's what's affecting me more than the cancer diagnosis itself and the surgery.
And at the time, were you ever warned by the cancer support nurses and anyone? Were you ever warned those side effects were gonna?
No, I read the inserts that you get on the medication, and
they freak you out anyway.
Yeah.
There's always so many effects that you possibly could have. Would you say you were unlucky with just your reaction to the drugs that were given to you? Have you met other women along your recovery journey, who actually had similar?
Yes, I have. Yeah, very similar side effects. I think particularly with the tamoxifen, a common theme is affecting cognitive ability. And I think for me it's very noticeable when it was in its really extreme stage, because I come from a teaching background, so I'm used to working in a fast-pacing environment, having to think on your feet and constantly being alert all the time, and going from that to barely functioning on a daily basis, it was very, very noticeable.
Yeah, scary, I would say.
Yeah, it was scary. I've been in my car and made irrational moves in my car, which you would have thought that she's got an L plate on. It's like, I haven't been driving for over 30 years. It's, and it was like, when I've done something, I'm thinking, oh my God, that was so scary. So, yeah.
And this whole time, obviously, you've spoken about Black Women Rising and that support community, but your family and your sons, what were they like around you?
I think because I don't think I fully absorbed the fact that I'd had a cancer diagnosis, and I was behaving as normal to them. And when they saw that, because I didn't know how else to behave, I was just being myself. And I think because of that, over time, very quickly, they realised actually she's still quite her usual jolly self. So, which was good for me, because I didn't want people tiptoeing around me and looking at me with that solemn look on their face. And, because I was still me.
Oh, absolutely. Yeah.
I don't want people to treat you differently and be with you. Well, thank you so much for talking to us, Jacqui.
You're welcome.
Such a beautiful part of our LoveRose community. It's so nice to be able to talk to you more about your story.
It's been a pleasure.
Experience.
Thank you for sharing your story with us.
You're welcome.
So much.
Okay, you take care.
We'll see you very
soon. You too. Take care. Bye.